Welcome back, everybody. We'll be taking your calls today, so pick up that phone, dial in. We want to talk to you. We're happy to have addiction specialist Dr. Charles Gant with us today. He's both a physician and psychologist and practices integrative medicine in the Washington, D.C. area. Dr. Gant researches, writes, and lectures on addiction treatment, psychotherapy, nutrition, and complementary medicine. We're going to be discussing his book, End Your Addiction Now. He'll be teaching us strategies that improve brain function, especially as it relates to addictions. Welcome, Dr. Gant. Thank you for coming all this way and being with us.
Thank you, Doctor. Busy schedule and everything. We're honored to have you here.
We sure are.
Can we start by understanding what you as a physician mean by addiction, dependency? You know, is there a difference? Help us understand those terms.
Yes, well, addiction is when a person's whole life is wrapped up around a chemical of some kind. It can, and the chemical addictions are the worst kind, but it can be any kind of compulsive behavior, gambling or anything. Dependency is when there's a physiological, a biochemical need for a chemical. So a little old lady who takes a sleeping pill once a night because she can't sleep is not addicted. Her whole life's not wrapped up around the pill, but she can be physiologically dependent because if she tries to stop it, then she can go into withdrawal.
So there's a behavior difference.
Yes.
Is that correct?
Yes, it's if the compulsive behavior or the chemical just encompasses globally the whole person's life, it's all wrapped up around it, then that's considered to be an addiction. The different drugs simply mimic those neurotransmitters. So we have one called serotonin, which is mimicked by SSRI type medication like Prozac and Zoloft and so forth.
Antidepressant type drugs.
Antidepressants. Okay. And then we have GABA, which is the natural Valium or Xanax, a downer or sedative. We have endorphins and kephalins, which you may have used for pain, opioids, and these drugs take the place of these natural painkillers. We have the natural nicotine in the brain, acetylcholine. We even have a natural marijuana in the brain called endocannabinoids, very, very important neurotransmitters. So these substances then mimic the neurotransmitter, and by doing that, the brain adapts and makes less of the natural stuff. So the more you use, the less you make, the more you want to use, and then an addiction is born. Stress of any kind, whether it's metabolic stress like low blood sugar or cognitive emotional stress that we face, will use up the neurotransmitters faster. Infectious stress, pain as a stress uses up the neurotransmitters faster. So chronic pain syndrome or having Lyme, I see a lot of Lyme back in the East where I practice. Any kind of stress that wears us down, whether it's a physical or cognitive emotional.
Well, no wonder we're becoming so dependent on drugs in this country.
Of course, it's obvious.
No wonder.
And you can't blame people for reaching out for something. If we're not going to educate people, we're not going to do the science, we're not going to do it intelligently, then you can't blame people for going for the chemicals.
Does this negate personal responsibility in taking charge in your life?
No, not at all. In fact, you're asked to take more responsibility for the recovery of body. So to eat right and to take the supplements correctly, to follow through in a very determined way of detoxifying, there's more self-responsibility than ever.